Most of the adults that I see in my practice with mental health problems are depression, anxiety. I've had a few cases of schizophrenia. I just recently had a case of a young boy with an acute schizophrenic break, about a paranoia that came about from a lot of stress. There's a lot of pressure, within his life. Interesting for him, which is his labs look very similar to some of the autistic kids. He had elevated markers for yeast, elevated markers for Clostridia. He had elevated markers that showed his dopamine levels were too high. On hair testing, he had very low levels of lithium. His adrenal testing, I did some adrenal testing, his cortisol levels were very low, which means he's been in sort of a long-standing adrenal stress standpoint. His cholesterol level was extremely low. It was around 120, 126, which is way too low. So just his brain is not getting the nutrients it needs, and his brain is being impacted upon chemically by what's going on in his digestive system. And I've seen that scenario play out with other types of patients. It's not just schizophrenia, it's anxiety and depression, or there may be not all of those markers, but a combination of them. And so what I tell people all the time is whether it's an individual with schizophrenia, whether it's an individual with depression or anxiety or bipolar, the same underlying physical problems can still be occurring. That's the beauty of doing the kind of testing we do, is if you can isolate and figure out if there's certain nutrients that are deficient, if there's certain toxicities that are being exposed to, work on those things. And many times the overall mental health condition improves. Now, there are certain cases that people need to be on medications, or there's other psychological factors and lifestyle and past experiences. But that's what I'm seeing with many of the mental health patients. It really is just a blending of these different types of exposures and underlying medical issues that need to be addressed. And they're not.